Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the multiple sclerosis. From multiple sclerosis, you will either get a short note or you will get a long note. Okay, it is that important topic. Now, multiple sclerosis is a chronic. So, what is chronic? Chronic means a disease which is of a duration of more than 6 weeks. Because if it is less than of 6-week duration, then it is an acute disease. So, it is a chronic disease and it is an autoimmune. That means auto means the cell and the immune system. Okay. Demyelinating disease of the central nervous system. It is characterized by what? It is characterized by 4 things. What are the 4 things? Let's see. First thing, there is repeated episodes of immune-mediated destruction of the myelin. There is destruction of the myelin sheath. Then there is axonal injury and gliosis. Multiple demyelinating plaques that are formed in the brain, optic nerve and the spinal cord. Next thing, there is relapsing remitting clinical course in most of the patients that we are able to see. If I talk about the epidemiology, it usually presents in people who are in between the age of 20 to 40 years, more prominent in females as compared to the males. Then more common in the temperate climate regions like in North America, Europe and Australia. If I talk about the etiology and the risk factors, first thing, genetic factors. So in the genetic factors, you have HLA-DR2. Then there will be first degree relatives and the monozygotic twins. Talking about the environmental factors, if the person is having low vitamin D levels, reduced sunlight exposure, smoking and obesity, then he or she is at the risk of developing the multiple sclerosis. Infectious triggers, what are the infectious triggers? Mainly in the infectious trigger, remember the viruses, the Epstein-Barr virus. Remember the Epstein-Barr virus. Coming on to the pathogenesis of multiple sclerosis. Now, this is the immune-mediated and T-cell driven demyelinating disorders. This you need to keep in mind. What are the key mechanisms involved? First thing, it is autoimmune T-cell activation. Now, what happens over here is, there is CD4 T cells. They react against the myelin basic protein. Second, you have the Th1 that secretes your IFN and they activates your macrophages. Then you have the Th17, they recruit your neutrophils. Next thing, you have the blood-brain barrier breakdown. Now they activates the T cell and crosses your blood-brain barrier. There is demyelination. Macrophages destroy your oligodendrocytes. Oligodendrocytes are basically the cells and the myelin sheath. And you know guys what? Oligodendrocytes have a very characteristic appearance of fried egg. Okay. Then you are having the axonal damage. That means there will be chronic inflammation which causes the irreversible axonal loss, which leads to the permanent neurological deficits. Gliosis is the last one, in which there will be scarring and the person will develop the multiple sclerosis. Coming on to the morphology. Now, remember this picture very carefully because it can be asked as a spotting in your practical exams. Okay, it can be asked as a spotting in your practical exams. Now, in the macroscopic feature, I am able to see multiple sharply defined and gray tan plaque. Okay, they are commonly seen in optic nerves, corpus callosum, brainstem, cerebellum and the spinal cord. Then you have the active plaque. This means there will be myelin breakdown, abundant macrophages with myelin debris and lymphocytic infiltrates. They will be there. Then you have the inactive plaques like in gliosis. There will be axonal loss and loss of oligodendrocytes. Coming on to the types. Remember the 4 types. First one, there will be relapsing remitting multiple sclerosis, most common. Then you have the secondary progressive multiple sclerosis, primary progressive multiple sclerosis, and progressive relapsing multiple sclerosis. You don't need to go into details. We will go into details when we come to our final prof. There in medicine, we will also read about the multiple sclerosis. So there, we will read in details. Okay. What are the clinical features? The first thing is visual symptoms. Now, in the visual symptoms, the first symptom is that of optic neuritis. Now, what happens in optic neuritis? There will be a painful loss of vision. Second thing, there will be diplopia. Di means 2. So, there will be 2 visions. Okay. It is due to the intranuclear ophthalmoplegia. There will be a lesion. Okay. It is due to a lesion. Then you are having the motor and sensory symptoms. In that, there will be limb weakness, spasticity, numbness, paresthesis, ataxia, and tremors. Okay, these are the flapping tremors. That is seen in which condition that you need to tell me. Then you have the brainstem and the cerebellar sign. In that, you are able to see nystagmus, dysarthria, and intentional tremors. Highlight with me a very important triad, Charcot triad of multiple sclerosis, that is SIN. What is SIN? SIN means there is scanning speech. Next, there will be intentional tremors. And there will be nystagmus. Okay. Then you are having the spinal cord symptoms. There will be bowel and bladder dysfunction. In the cognitive and the psychiatric, there will be depression and mild cognitive impairment. Coming on to a very important thing, that how we will diagnose that this is the patient of multiple sclerosis. So there are multiple ways of diagnosing it, right? The first thing is you are able to see what there is a criteria. Highlight this, okay? There is a McDonald criteria, not the McDonald that you eat. It is a McDonald criteria, and these all other things are included in your McDonald's criteria. First thing, you are able to see on MRI, it is the investigation of choice. You are able to see Dawson's finger. We are able to see the Dawson's fingers. Okay. Then there will be the gadolinium enhancement. In the CSF findings, I am able to see the oligoclonal bands, and there is increase in the IgG index. In the evoked potential, there will be visual evoked potential, which shows delay conduction in the optic pathway. So there is delayed conduction in the optic pathway. What are the differential diagnosis? In the differential diagnosis, remember it with the help of mnemonic. What is the mnemonic that we can make? Okay. Remember NAVCLS. Okay. NAVCLS. Now, you have the neuromyelitis optica. Then you have the acute disseminated encephalomyelitis, vitamin B12 deficiency, CNS vasculitis, Lyme disease, and sarcoidosis. These all are the DDs or the differential diagnosis that we can make. What are the complications you are having? You are having the progressive neurological disability, spasticity, urinary infection, paralysis, cognitive impairment, depression, and pressure sore. Coming on to the treatment. How will I treat my patient of multiple sclerosis? So for the treatment of acute relapse, you can give the patient high-dose IV corticosteroids like methylprednisolone. Then you can go for the disease-modifying therapies. And guys, one request I need to make it to you, that whenever you are reading this, just correlate with your pharmacology also. Okay. Now, then you can also give the symptomatic treatments like antidepressants and physiotherapy. Now, prognosis is better with females as compared to males. In males, it is worse. This thing you need to remember. And the treatment part, please study in details from your pharmacology. Okay, I think we are done with the multiple sclerosis portion. If this question comes in your university exam, this is the same pattern that you will be writing your answer in. Okay, like first thing, definition, epidemiology, risk factors, pathogenesis, morphology, types, clinical features. Then you will write the diagnosis, differential diagnosis, complications, and treatment. This should be the pattern you will be following while writing the exams. If you have any sort of doubt, please feel free to ask me, and please don't hesitate. Thank you so much.